First OD, Dr. Song Hae-ji.
Dr. Chi obtained his medical degree from Gyeongbuk National University. After military service, he went on to a 2-year residence at Inan Medical Center, followed by a 2-year fellowship at Charlotte University as Rear Surgeon. Dr. Chi performed in Michigan's first open heart surgery at Inan. In 1987, Dr. Chi was honored with the Health Leadership Award. The Michigan State Senate and House of Representatives passed concurrent resolution honoring him. In 2005, Inan Regional Medical Center built new Heart and Surgery Center, and its new patient tower has been named the Chi Heart and Surgery Center after medical luminary Sung Chi and
Thank you. My response to this award is going to be short and brief. Thank you very much. And this is a great honor. And also, I'd like to thank everybody for this award. And it's a great honor for me and deeply humbled. Thank you so much.
So we're going to hear more from him in the presentation time. Okay, next, Mr. Robert Tully.
Robert Tully is president and founder of the Korean Art Society. They publish the only English language printed for outside of Korea on Korean art. The Korean Art Society has the largest lending library outside of Korea on Korean arts, including a number of rare books and publications. We were started the Korean Art Society to have Korean art. That others do not have.
안녕하십니까 여러분. 잘 들을 수 있습니까? Thank you very much. This is really a great honor. Thank you to Michigan State University and to the Council on Korean Studies. Thank you to Professor Kang. And thank you for this recognition of the Korean Art Society. We've worked hard to promote appreciation of Korean art and culture, and we are very grateful for this honor and thankful to share the stage with Dr. Chi. I don't deserve to share the stage with a man of such great accomplishments, but thank you very much, and I look forward to talking to you, all of you, talking to you more soon. Thank you very much.
Hello, thank you for coming. So my name is Peter Yu, Senior Vice President at CKS, and I am greatly honored to be here with these two distinguished persons. And so when I just first came to Michigan, 1982, I heard about Dr. Chi. He was so famous, not just in our town, but throughout Michigan. And I heard about his legacy and great stories. And I would love to just meet him. But just living in Lansing community, I just have a great chances to just meet him and know him much better. And so this is a very special event, and we are really honored that Dr. Chi not only a famous cardiac surgeon, but he was an inspiration for the Korean community. And with Dr. Chi's leadership, that time it was in a medical center, he really carried out, and hospital could survive because of his legacy. So many heart patients just came into New Medical Center, which is different name right now, McLean. And so I'm really honored to introduce him and then also to work with him today. And my family tradition at my home, when I just sit down at my dinner table and I hear all those strange medical jargons which I don't understand because my wife is a doctor, my 3 children at medical school, and I'm really isolated. But however, if you just listen to Dr. Chi's presentation today, you can have a great knowledge. And I will encourage you to just go ahead for doing yourself surgery on the heart, but don't do it first. But maybe you can try on your dog and yourself, and then maybe you can just move on to somebody else. Dr. Chi. 앉으세요.
Can you hear me okay? Yes. Yeah. Okay. I would like to express my sincere gratitude to being selected by the committee for this honor and opportunity to share my story with you today. I'm not a professional speaker, so humbly ask your patience as I walk through my story of how I ended up in Lansing, Michigan. Before I go to my story, I want to give you a little joke about medical doctors. I hope not to offend or insult anybody or any doctors. Psychiatrists, they don't know anything and they don't do anything. Internists, they know everything but they don't do anything. Surgeon, they don't know anything but they do everything. Pathologists, they know everything, they do everything, but one day late. So much for my joke. Here's my story. I was born in South Korea and graduated medical school, Gyeongbuk National University, back in May of 1950. And I was 21 years old. Less than 2 months, 45 days exact, after graduating from medical school, June 25th, 1950, Korean War broke out. So I was drafted to Korean Army as an Army surgeon, and I was dispatched to front line right away. And many of you may not realize or may not know, during I was growing up in Korea, and also during the period of Korean War, pulmonary tuberculosis and lung cancer was the leading cause of death among Korean people. I was serving Army surgeon for 6 years. One time, I was assigned to U.S.A. Medical Dispensary Unit in Seoul, Korea for 6 months. And I had an opportunity to associate with the U.S. Army medical officers and surgeons, and communicating with my broken English, and I expressed my desire to become a chest surgeon in the future, in order to help dying people from lung tuberculosis and lung cancer in Korea. One of U.S. Army surgeons asked me and encouraged me to go abroad to United States for further medical study and training. So I started to apply for an internship in the United States, many hospitals. Luckily, I was accepted by as an internship at the Fairview General Hospital in Cleveland, Ohio. And I came to the United States in July of 1956. I was there for 5 years, 1 year internship and 4 years of general surgery residency program. End of my 4 years surgery residency, I wanted to pursue my further study in chest surgery, and I applied and I was accepted in the Lansing Chest Hospital at that time in Lansing, Michigan. And I came to Lansing July 1961. And I was there for 2 years for chest surgery. And as you may not know, the Ingham Medical Hospital was a sanatorium since 1913. And later, 1960, changed to Ingham General and Chest Hospital. And I was there for 2 years for chest surgery residency program. And toward the end of my 2 years, my boss, Dr. Stanley, who is my boss and also chest surgeon, asked me if I want to stay in the United States and work with him and arrange to help him to develop a cardiac program in Ingham Medical Hospital. But I told him at the time my visa status was exchange visitors, they call J visa. And in order to stay in this country, I have to live at least 2 years in this country, and then I can come back to the United States for changing my visa status. And I told him, my boss, and he said, don't worry, I'll consult with the local district congressman and also Michigan State Senator for special petition in for changing my visa status. And also further, he made an arrangement for me to go to Toronto, Canada for 2 years for cardiac fellowship. And we went, my wife, and we had one boy at that time. We went to Toronto, Canada, 1963, July. And I was there for 2 years. First year I spent pediatric cardiac surgery fellowship at the Sick Children Hospital. And the second year I was in St. Michael Hospital for adult cardiac vascular program. And end of 1965, I was able to come back to Lansing and joined medical staff at the Ingham Medical Hospital. As you may not know, Ingham Medical Hospital was a sanatorium for tuberculosis patients since 1913, and 1960 became General and Chest Hospital. And after I came back from Canada, my first priority was setting up dog lab in the basement of the Ingham Medical Hospital, conjunction with the MSU vet school and the clinic. Dr. George Eister, and set up dog lab, and I organized and assembled cardiac team, doctors, nurses, and also pump technician, and we started doing open heart surgery on the dogs 2 times a week. But finally, September of 1966, I performed the first open heart surgery on 16-year-old girl who had a cardiac defect, congenital heart defect, we call atrial septal defect, and which was repaired and successfully. That was the first open heart surgery in mid-Michigan. Since then, we have my cardiac team has performed over 10,000 open heart procedures at the Ingham Medical Hospital. Before 34 years during my medical practice, and I was retired about 21 years ago. And before I go further, I'd like to give you a brief rundown on some couple of subjects related to the heart, anatomy of the heart, and secondary so-called heart attack. And as you know, human engine is our heart is a human engine, and it's a mysterious and very complicated. And I don't know, you may not know size of our heart is bigger than our one fist, but the smaller, little smaller than two fists together. Of course, a little different in individual, but in generally speaking, about a little smaller than 2 feet together. And the heart has a 4 chambers, 2 and I don't think you can see the one. Can you hear me okay? Yeah, okay. 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 And this is the right side of the heart, and that's the left side, and this is just a lower. We had 2 chambers in the right side and 2 chambers on the left side, and the 4 chambers in the heart. And the right side of our heart handles the venous blood. Venous blood is usually dark and pink, dark and purple blood. And blood coming into the right upper chamber, we call atrium, go through the little valve, one-way swinging door, go through the left ventricle. Then when heart contracts, blood going out to the lung. When you breathe, the hemoglobin pick up oxygen and exchanges carbon dioxide and oxygen exchange, then become pink red blood, which come into the left side of the heart and upper chamber, then go through another swinging door we call mitral valve, go through the heart, the left ventricle. When heart contracts, blood pump out to the brain, liver, kidneys, and all over our body, and distribute oxygen to the body, then become picking up CO2, carbon dioxide, and come into the right side of the heart again, thus the circulating blood throughout the body. Imagine that the mysterious heart, without resting, continue to pump 24 hours a day, 365 days a day, continue to pumping millions and millions of gallons out to the body for supplying oxygen. And as I said earlier, 15-year-old girl who had a atrial septal defect, we call it a congenital development anomaly of the heart during her fetal life in the uterus of her mother during the pregnancy. and quite did not develop normal, and septum between upper chamber of the right and the left heart, and they made a hole and did not close completely, and the blood, that's blood coming back and forth and left and right, and supplying unoxygenated blood to the body, and they don't live a normal life. So which was prepared September of 1966 by me. And comes down to the another subject, the heart attack. Heart attack is the number one killer in the United States. So many 100,000 people dying in the United States with a heart attack. And human engine is built up of two fuel pipe we call coronary artery here, which supplies blood oxygen to the heart muscle, we call myocardium. And generally about 60 to 80 cc of blood going through the coronary artery to the heart muscle. And when you have a blockage or partial blockage or total blockage of the vessel, this artery give you a heart attack. Heart attack means we call angina. It's a severe chest pain starting out from the left side, radiating to the arms and also neck. So when people suffer from severe chest pain and drop on the floor, that means usually they do a cardiac arrest. Then before you start anything, you check the pulse in the carotid artery. If you don't have any pulse, that means a cardiac arrest, so you have to start the cardiac resuscitation right away. And before you do that, you pump the chest a couple of times. Sometimes this stimulate the heart, and the heart starts pumping again. If it's not, then of course you have to call 911, and also you start your cardiac massage. That way you may be able to save life one or two in 100 maybe. When you do have a cardiac pain, in other words, angina, you should check with the doctors for further study. And here we have nowadays they inject a dye into the coronary artery, and here you can see that the little marker there, narrowing of the blood vessel. And now they do stent procedures, which is local, and you put in a small coil inside of the heart vessel and stretch out and restore blood supply to the heart muscle. And in multiple cases, if you have many blockage, then you go through the so-called heart bypass, coronary artery bypass operation you see over there in the right side. So much for the heart. And now back to my story. And since first open heart in September 1966, our team performed over 10,000 open heart procedures during the 30 years of my medical practice. Before 21 years ago, I retired 21 years ago. So over 10,000 people went through directly in our team. And lastly, I like a copy of a quote from 4-star U.S. General Army General. I don't know, you may remember Douglas MacArthur during the World War II. His final retirement speech, quote, old soldier never die, just fade away. Like I said myself, maybe old soldier never die, just fade away. And at my closing my speech, I appreciate Dr. Kang for preparing for all these slides for me. And also I appreciate very much all the committee members for selecting me as one of the recipients of the prestigious Global Korea Award. This is a great honor, and I'm deeply humbled. Thank you very much.
I'm going to share the old newspaper, like the State Journal, published on the March 17, 1968. So how many of you were born after this? Many students, right? So there is some. Can you see this handsome guy? And this is about the dog surgery, like news article regarding dog surgery. So I'm going to share with you.
Okay, so he's a real humble man, so he doesn't really say it. So I think I have to really just say to the community that if you go to McLaren Hospital, there's a special unit and tower, and even elevator, and all, the unit is dedicated to Dr. G. It's called G Tower. And so you'll be really impressed. And then over the years, so he donated millions of dollars to the hospital and community. And so, Dr. G, I really thank you very much.
Thank you.
Yeah. Also, I know that now you are really expert in cardiovascular system. So at the end of the seminar, we'll have some brief test, medical test, okay? Okay, thank you. And now, yeah. Okay, so we have a question and answer session. So if you have any question or some concern about your, the health, especially related with the heart, and raise your hand and ask me. So free consultant, okay?
We all have the same question, how to prevent heart attack. How to prevent heart attack?
Well, I'm not a cardiologist, so actually I cannot tell you exactly how, but I think that we have to first of all watch our cholesterol intake. And generally, heart attack, like I said earlier, the partial blockage of the coronary artery build up from cholesterol build up inside of the vessel, and it completely plugs up. Then they call myocardial infarction, heart muscle die partially, or if a major vessel involved, then they develop cardiac arrest. So you have to watch your diet and also exercise, I think. And also, if everybody over 45 or 50 years of age in this country, they should take some aspirin, ASA. In generally, if you take too much, they bleed too much. So take the baby aspirin maybe, which is 81 milligrams, about one every 3 days or 4 days, something like that, just in the blood. So it won't develop blood clots inside of the artery. That's all I can tell you.
In this room, there are a lot of young students. So while I'm working with Dr. Chi regarding this PowerPoint presentation, I got this one from Dr. G. So actually, this is Dr. G's life mode: diligence, faith, and enthusiasm will prevail. So, Dr. G, Do you have any message you would like to deliver to young students regarding this movement?
No, not really.
그냥 끊임없이 열정을 다하고 성실하면 성공한다. 이것이 지 박사님의 모토입니다.
So I got question, Dr. J. Kim, so renowned athlete and professor at Michigan State University. He exercised so much, but he had a open heart surgery, I believe. So what's the cause? So I asked, so even active athlete just can have problems like that. Yeah. Like somebody is really active in exercise and.
Well, exercise is good, but if you overdo it, of course, you strain on the heart. So you have to watch. You have the happy medium, I should say, and also again, you have to watch your diet and mild exercise. I think golfing is good, isn't it? Yeah.